Chapter 32 The Scheme 2. Exercise 32.1. Write the corresponding medical terms from the ordinary English word and say what kind of force is involved. Look at A opposite to help you. Common word, medical term, type of force. Bruise, contusion, blunt. Cut, incised web, sharp. Brace, abrasion, blunt. Scratched, abrasion, blunt. Stab wound, penetrating wound, sharp. Tear, laceration, blunt. Exercise 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow and on the left side of the neck, a contusion to the left side of the lower lip, and tears to the left cheek. Exercise 32.3. Write a description of the injuries shown in the illustration. Look at A and B opposite and at 32.2 above to help you. There is a laceration tear on the left shoulder and an inserted wound, a cut approximately 6 centimeters in length above the left nipple, left nipple. Exercise 32.4. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. Number 2. He had several stab wounds in the abdomen from the knife. Number 3. He was knocked unconscious by a heavy punch to the head. Number 4. The wounds were only superficial and required no treatment. Chapter 33. The urinary system. Exercise 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. Number 1. Frequency and nocturia from 1 year. Dysuria or hesitancy, string a little weaker. No incontinence apart from occasional leaking dribbling. Exercise 33.2. Match the patient's descriptions of their symptoms 1 to 7 with the medical terms A to G. Look at A opposite to help you. Number 1. I have to pee every half hour or so. Letter B. Frequency. Number 2. I get a scalding pain when I pass water. Letter A. Dysuria. Number 3. I have to get up several times to pass water at night. Letter E. Nocturia. And number 4. I have to rush to go to the toilet. Letter F. Urgency. Number 5. I have trouble getting started. Number letter D, sorry, hesitancy. Number 6, I can't hold my water. Letter G, incontinence. Number 7, I passed some blood in my urine. Letter C, hematuria. Exercise 33.3. Write the doctor's questions for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own questions for urgency. Number 1, frequency. How often do you pass water? 2, dysuria. Do you get any pain when you pass urine? Number 3, nocturia. Do you have to get up at night? Number 4, urgency. Do you have to hurry get to the toilet in time? Number 5, hesitancy. Do you have any problem getting started? Urine incontinence. Do you ever lose control of your bladder? Hematuria. Have you ever passed blood in the urine? Exercise 33.4. Describe the findings of the laboratory report in words. Look at B opposite to help you. There was a trace of blood, prematuria, and not cast. Chapter 34. Basic investigations. Exercise 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlined expressions. Choose 1 to 4 to expressions with similar meanings from A opposite A to D. Write Mr. Gold, because you've been having these headaches. I'm going to have a look at your eyes, particularly the back of your eye, retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear this will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blind. Now, I'd like you to look ahead, straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me. Look at the clock. Number 1, letter B, a topical dramatic solution. A couple of drops. Number 2, to end dilation, which will make it easier for me to see the retina. Number 3, letter A, the examination is done with dimmed light. I need to get rid of as much external light as possible. And number 4, fixate on a target. Letter D, look straight ahead. Look straight ahead at that clock. Exercise 34.2. Complete the instructions. Look at B opposite to help you. Wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Number 3. Close the valve on the first. Number 4. Pump up the pressure to at least 150 uh, millimeters mercury. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. Number 5. The first sound hear you hear is the flow of blood through the brachial artery. The bullet on the gauge at that point is the systolic blood pressure. Number 6. Continue listening while you slowly deflate the cuff. Number 7. The diastolic blood pressure is measured when the sound completely disappears. Exercise 34.3. Complete the test. Look at C opposite to help you. Number 1. Phlebotomists are specially trained in taking blood. They are skilled or manufacture puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding to prevent bruising at the side. Bruising at the side. It is important that the specimen teeth are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out.